Hello and welcome to Module 1, our lecture on the global impact of dementia. Our objectives for this lecture are to describe the prevalence rates worldwide of dementia, to describe the disease burden across different countries, and to identify known risk factors for dementia. We'll begin by discussing the prevalence rates and how they're changing globally.
This slide gives you a sense of the dramatic increase in the rates of dementia from 2010 to 2050. Also, it shows how prevalence rates do change based on method of ascertainment. So initially, 36 million people around the globe were considered to have dementia in 2010. But in re-examination of how prevalence is ascertained, in 2013, a new rate has been proposed by Dr. Prince and his colleagues of the World Health Organization and Alzheimer's International. So in 2013, it appears as if there are 44 million people worldwide with the disease. This is going to increase sharply by 135 million people by 2050.
Wow, it's really interesting.
Here you see the distribution of who is shouldering the burden of dementia. Higher rates of dementia are found in low and middle income countries. And you can see in the slide that over time in the high income countries, the rate basically stays the same. And Nancy, for the low and middle income countries where you see that it increases, that may be due in large part not only to better ascertainment methods of dementia, but also because people in middle income countries are living longer. And also there's some new evidence coming out of Western Europe and also the United States that the prevalence rates for dementia may decline. Now, this evidence is preliminary, but it is suggesting that perhaps one reason for the decline in high-income countries is that there have been changes in lifestyle, which may be impacting this rate.
I was reading just that, in fact, maybe it's the management of heart disease or better management of some of these chronic illnesses.
Yes.
That may be accounting for this change in the wealthier countries. It's really fascinating.
It's really fascinating. And also there's some new research showing, for example, that bilingualism is a factor that can reduce one's risk. And so how that plays into all of these rates is something of great interest that we need to stay on top of it. But the main take-home point from this slide is that low and middle income countries, which means what? They're resource poor, are shouldering the burden of dementia. And not only that, but the rate of dementia is growing exponentially in these countries. So this slide also illustrates similar points, but looks at specific countries. And you can see in this slide, if you click again, that in Asia, Eastern Asia, that the rates of dementia were initially underestimated by almost 8%. And the same in sub-Saharan Africa. And also you can see very high rates in Latin America. There's a recent study, by the way, that shows that in Colombia, the rates of dementia may be 50% higher than that which was originally indicated, even as early as last year. So these rates are very important for lots of different reasons. They shape policy, they impact resource allocation for societies. So it's very important to understand these rates, how they may fluctuate. And again, we see here that some of the poorest regions of the world are having a much larger prevalence rate than other aspects of the world, and from which was originally considered.
This slide will just sort of highlight the difference in prevalence rates across the world. So in North America, the prevalence rates in 2006 were 3.1 million. And this estimate is, there's an estimate to increase this rate by 2050 up to 3 times higher. So 8.85 million people are predicted to be affected by dementia in the year 2050. Differentially, in Latin America, where we saw on the previous slide what a high prevalence rate they have there, in 2006, there was 203 million people estimated, but by year 2050, that number is almost fivefold, 10.85 million individuals to be affected in Latin America. In Australia, the prevalence rate in 2006 was 0.23 million, and by 2050, that number is estimated to be 0.84 million individuals, almost fourfold. In China, the prevalence rates in 2006 were 12.65 million, and by 2050, the number is estimated to be 62.85 million individuals. Again, driven a lot by population aging in that region of the world. In Africa, as you were mentioning, the prevalence rates in 2006 were 1.13 million, yet by 2050, the estimate is almost sixfold, 6.33 million individuals. And in Western Europe, in 2006, the estimate was 7.21 million, yet by 2050, that number will more than double to be 16.51 million.
So just getting back to that globe, I think what we want people to think about is what are the prevalence rates in your region and in your country. And it would be important to understand what those rates are so that you can also see what kinds of resources are going to be allocated to the challenge of dementia care.
Mm-hmm. So now let's move into considering, now that we have some understanding of how prevalent this disease is and will certainly become more prevalent, what does that mean in terms of the global burden placed on society as a result of this disease? And this slide really shows how Alzheimer's disease in particular, and the rates of Alzheimer's disease, are projected to increase in the United States. This is U.S. data. Almost by 65%, compared to other chronic diseases that we're getting much better at managing and for which there are many more research dollars being allocated to understanding. So we see, for example, in terms of strokes, which are highly treatable and manageable once we put in place some preventative strategies, that rates of this disease are declining. Rates of prostate cancer and breast cancer are also declining. Heart disease and HIV are also projected to decline. And yet the only major disease category projected to increase is Alzheimer's disease, almost by 70%.
You know, what's really interesting to me about this slide and very important is that it shows that when a country organizes itself to address a particular health condition by looking at patterns of care and also through research, the impact it can make.
Yeah.
And I remember specifically even HIV, and that used to be above the zero, and that many people used to die with HIV. And this has now become a much more manageable chronic illness. And so the question really is for us to say, if we did allocate sufficient resources, could we reduce the number of people who die as a consequence of Alzheimer's disease? So even though these numbers are relevant to the United States, we understand that this is a similar pattern worldwide.
Mm-hmm. And I think we'll get into it more also when we look at the different countries that have more well-developed national plans and the different levels of plans that different countries have across the world.
Another aspect of burden of care has to do with the cost. And these numbers represent the direct care costs of what it means to have a population that has a high percentage of dementia. So in Asia Pacific, for example, it's estimated that the cost of care is $82 billion. In North America, another high-income area, it's $213 billion. And in Western Europe, it's $210 billion. And these are just staggering costs that pretty much are shown consistently across various kinds of studies as to the direct care costs that dementia poses. This refers to missed days of work, healthcare costs, hospitalizations, caregivers, time, and so forth. Another cost to dementia, or the burden in which the disease exerts itself, is towards women. So women do bear the burden of the disease more than men. And what these bar charts illustrate is that at each age, women have almost double the rate of dementia. Now, some of it can be explained by women living longer,
right.
But we really don't understand exactly why women are more vulnerable to dementia than men.
I remember some of the years where we were studying the effects of estrogen as a potential explanatory factor, in that in postmenopausal women, perhaps the reduction in estrogen would account for this increased risk. But I recall that the estrogen trials really didn't show any benefit, and so that supplemental estrogen doesn't seem to reduce the risk in women. To your point, perhaps it is just the survival benefit of women outliving men that may explain for their higher risk.
Another burden of dementia is shown in terms of its differential effect on race and ethnicity, particularly in the United States. So in the United States, African Americans and Latinos have higher rates of dementia at each age group. And exactly the reasons why and how this is related to social determinants such as education level, occupations, income is still not clear.
This slide really now moves into how family members are affected. We've been talking about prevalence rates of people with dementia, with an understanding that at least for every person with dementia, there's at least one family member who's providing caregiving, and in fact, it's often more than one individual. And then in the U.S., it's estimated that 15 million family caregivers are providing care to persons with dementia. And compared to other illnesses, individuals that are caring for persons with dementia have a higher burden of care. Perhaps it's due to the longer duration of care, the individual's behaviors that may occur as part of the illness, the increased dependency for physical needs over time. And again, these long years of caregiving have impact financially, emotionally, on one's physical health, and so there's many consequences.
You know, Nancy, most of the research on family caregiving in the United States consistently shows that families who are caring for a person with dementia compared to families caring for an older adult with, let's say, physical frailty, for example, have so much higher rates of depression and stress and lower financial have more, I should say, financial burden and physical health burdens. And this has been a consistent finding. And the other thing I think it's very important for us to remember is that most people with dementia, and this is true globally, do live at home. And they are cared for by one or more family members. And that family member should be defined in the broadest sense. It may be relatives, it may be neighbors, it may be friends, but family in the largest sense of the term are responsible for over 80% of the long-term care of people with dementia.
And you were mentioning that very vast literature showing the negative effects of caregiving on people with dementia, but I think what's also important and is bulleted here is just that there are also people who report that caregiving has been a vocation for them, that they've had tremendous learning, they've developed a wonderful relationship with their loved one and had a chance to give back. So I wouldn't want to minimize the potential positive aspects that caregiving provides people.
Good point.
And here this slide is really just showing how much longer people who are caregivers for persons with dementia are caregiving. And so what you'll see in blue is who are the caregivers of patients with dementia or persons with dementia. They're more likely to care for their loved one for more than 1 year. And so you see just much longer rates of caregiving, which again could account for the greater level of burden that often is experienced by these individuals.
The point also here is that, as we've learned from Dr. Albert's lecture, that dementia occurs over an extended period of time, and it could be upwards to 20 years. So that the needs of people with dementia, as well as their family caregivers, will change as the disease progresses, and so different challenges and burdens are experienced at different stages of the disease process. And I think that's kind of a hidden message in this slide as well. So let's go on to look at some of the risk factors of dementia and what we know. The number one risk factor is age. This is data from the United States, but it is representative of what we know about dementia in general. 1 in 9 people age 65 and older, or 11%, have Alzheimer's disease. About 1/3 of people age 85 and older, or about 32%, have Alzheimer's disease. And of those with Alzheimer's disease, the vast majority are over the age of 75. So you can see age plays a very important role here. Now, risk factors may differ depending upon one's stages of life. And this is a very helpful chart that we hope that you will take a very careful look at. It suggests that in the developmental years, there are certain factors that occur that may pose as a risk factor later on in life. So, for example, nutrition, education, one's occupation, or different kinds of life events that may occur may have a risk factor. Now, you'll see from this chart that the level of evidence for any one of these risk factors is still questionable. We need much more research in this area. But it appears as if they may have some effect, but the strength of that effect is still unclear. Now, take a look at the middle and later stages in life. And here, what it really pops out is that being a smoker is one of the risk factors that has the strongest evidence. We also know that nutrition may have a role, and also that physical activity may play a role, but much more research is really needed to see the relationship to the risk for dementia.
And so it looks like among many lifestyle factors, not taking care of oneself, not eating well, abusing alcohol or smoking may increase one's risk. And yet there are still some things we can be doing to reduce our risk. Certainly, I guess as you were saying, there's no sufficient evidence to say that there is one lifestyle factor that would remove your total risk. And I'm sure we all have examples of individuals we know that have been very healthy individuals throughout their life, have really taken care of themselves, and yet still develop dementia. But there does seem to be some very promising evidence that there are a number of things in terms of healthy lifestyle that we can do to lower our risk. And these include, one, looking after our heart because of all the circulatory factors that can interfere with circulation to the brain and increase our risk of dementia. Being physically active, following a healthy diet seem to be important factors. Some evidence suggests that doing some challenging our brain, certainly education in early life, had
and
pretty
bilingualism.
robust, that's right, yeah. So there is some evidence for challenging our brain. And the importance of having a social network is one factor that wasn't addressed on the earlier graph, but I've seen some really promising research about the importance of social activity as a protective factor in risk for dementia.
So it looks as if taking care of one's heart can help take care of one's brain. And we know that, for example, genetics accounts for only about 10% of the prevalence rates in dementia, and that chronic illnesses that do affect the circulatory system, such as high blood pressure or diabetes or cardiovascular disease, can increase a person's risk for dementia. And
so our major take-home points from this lecture are, first, that prevalence rates overall are increasing worldwide across the globe, but more so in low and middle income countries that are resource poor.
Women bear the greatest burden of the disease. They have a higher prevalence of dementia, and they are actually mostly caregivers.
And in the U.S., certainly race and ethnicity seems to be a risk factor for higher rates, such that African Americans and Hispanics have higher rates of dementia than do whites.
There's also greater evidence that social determinants may account for a high percentage of dementia. So we have to pay attention to education, income, nutrition, lifestyle, social engagement, activity engagement. All of these factors, although more research is needed, they may reduce the risk of dementia.
Hope you found this information interesting. Look forward to your comments.